Hi, my name is Lexi Stewart, and this is my video journal assignment for POL 1133, and the topic I chose was healthcare in Texas. Starting off, looking at why healthcare is such an important issue in Texas, is seeing how healthcare is a basic need that keeps the population healthy. It also allows people to receive and have some sort of access to medical treatments they didn't have access to before. But it has been on the decline in recent years because of the high rates of people without health insurance. And improvements need to be made to help better healthcare and patient care. Diving into healthcare challenges in Texas, the main issues I found were the delivery of healthcare, cost, impact of COVID-19, and the rates of people without health insurance. First off, with what is hurting the delivery of healthcare, is sometimes patients aren't informed of what they're being charged for until they receive their bills and see the final cost. Next, some doctors have even been performing unnecessary procedures for money or just out of convenience, and maybe not even doing what is in the best for their patient. Lastly, patients aren't receiving proper care. Hospitals are more knowledgeable and worried about prices than they are worried about the quality care their patients receive. Moving on to see why costs are so high, and it is because of the new technologies and medications that are so helpful and innovative, but are extremely expensive to make. And with these costs being so high, people avoid getting medical attention because they don't have the money and continue being sick, hoping that their illness just goes away. And since many people just don't have healthcare coverage anymore, hospitals have to provide uncompensated care that they have to later cover the cost of any medical treatments that aren't paid for. One statistic showed that hospitals in Texas covered $5.5 billion of uncompensated care in 2014. Now looking at the effect of COVID-19 on healthcare, it caused businesses to shut down or close, leading to employees losing their insurance coverage. And with COVID-19 was being so unexpected to spread so rapidly, hospitals and doctors were prepared with equipment, capacity for patient resources, and needs to keep people healthy and safe. Since people have lost their jobs or time and money, people aren't able to take off sick leave because they need the money for food or rent. Looking at a statistic of how COVID-19 has affected people losing their insurance coverage from the month of February to May 2020, in Texas, it can be seen that the rate was 46.2%, while nationally it was 51.2%. Looking at the final issue of the high rates of people without health insurance, it was also a factor when we discussed that it has been affected more by COVID-19 with people losing their jobs. Texas was also one of the few states who didn't expand Medicaid, which would have helped lower the rates of premiums on insurance. And with these premiums being so high and costly, most people have to worry about paying for the basic necessities before they can worry about health insurance. Now addressing these different issues, it can be seen that they all connect to each other with how they affect healthcare. There's not just one simple solution to fix all these things. Starting off, one thing that could be is to put extra investment to outreach and enrollment assistance for public insurance programs, and put more advertisement on telemedicine and remote patient monitoring to give patients better individual care. Also, having hospitals to be prepared and be able to have extra resources to be used in an emergency situation. Lastly, to reduce the rates of uninsured people because of COVID-19 is to continue the patient protection program. And now, with looking at the criticism my solutions might receive, I believe people might say, how will all of these things be paid for? How will things be distributed for people to gain these advancements? And will any of these solutions even be helpful for the future of Texas healthcare? My response back to this criticism would be, by moving more money to be spent on healthcare, it will only be beneficial to the state, and people will pay this money back with them being able to receive health care and pay for their medical expenses. And informing people of how these advancements are accessible is to allow them to have informative instructions and websites to help inform people and show them what resources are allocated to them. And lastly, all of these solutions will only be beneficial to help the future of healthcare. Trying to have more people insured, lower costs, have better quality, and more preparedness for the state of Texas healthcare. Thank you so much for listening to my slideshow presentation for the healthcare in Texas.